Hi everybody, it's Jojo Hogan here from Slow Postpartum, and today I've got the lovely Yee Yeoman with me from Bump and Beyond. Now Yee is a pelvic physiotherapist, and I first met her a couple of years ago when she treated one of my postpartum clients and did a wonderful job in helping her heal and recover, I should say, from the birth of her baby. Now, I've always been a huge fan of pelvic physiotherapists for many different conditions during pregnancy and postpartum. I've always recommended that my clients seek their advice and sometimes treatment. And so I thought we'd get together today with Yee and get her to tell us a little bit more about what a pelvic physiotherapist does and the different conditions that they can help to treat. So thanks for meeting with me today,
No,
Yee.
thank you for having me.
So great.
Yeah.
So can you tell me, we'll start off by saying, what is a pelvic physiotherapist?
Yep. So a pelvic and a woman's health physio specialises in any problems to do with from this section down, really. So you can't really say it, but in the pelvic region. So and also any stages in a woman's life. So from during teenage years to pregnancy, postpartum, and through menopause, and that covers a range of issues. So to do with your bladder, your bowels, so with incontinence and leaking to constipation, any sort of heaviness or signs of pelvic floor dysfunction down in that region. That's what we tend to cover and specialise in.
That's a very good point, because I just, as you said that, I always kind of think of pelvic floor physios as, a physiotherapist is treating muscles and joints, right? But actually what you're talking about is that you're treating a lot of the organs as well.
Yes, that's right. So it's an area that not many people know about, and particularly until you have issues, but it's good to have that knowledge beforehand so that the issues don't come up later on in life. So I'm all about preventative care, and often this is the area that most people don't know about because it's an embarrassing problem, and women tend to just accept it and carry on with life and think it's normal after having a baby, which isn't.
It's not. That drives me crazy. That's, I think, why I'm so passionate about this area, is because so much, this is after working with pregnant and postpartum women for over nearly 20 years now. One of the things that really annoys me is when women are told that they just need to put up with this condition, and that is absolutely not true. So when we say put up with it, I'm talking about, maybe back pain and hip pain in in pregnancy, or incontinence, urinary, or even sometimes bowel incontinence postpartum.
Yes.
Things like that. And women say, oh, well, I've been told it's just, and pain during sexual intercourse is the other one. And these things can have a really detrimental effect on women's lives, but they are treatable, aren't they?
Absolutely, yeah. It's there. So what we treat tends to be, so during pregnancy you can have low back pain, or the general umbrella term, what they call it now, is pelvic girdle pain. So it encompasses your symphysis pubis dysfunction, so pain in the groin area, or low back pain, or what was commonly known as sacroiliac joint dysfunction. Other problems such as tailbone pain, or what we call coccydynia. So all of these conditions, those are the common ones, and people tend to just accept that it's okay because it's common and it's just what happens during pregnancy. But we can definitely alleviate some of those symptoms and provide solutions. We may not be able to take the pain away completely, but we can help make it a bit more manageable and comfortable.
Definitely. And the other thing that you can do, which I do as a little bit as a yoga teacher, but I always refer people to a physio as well, is that you can give advice on exercises to do, exercises to avoid, things that can make it better, things that can make it worse.
And it's important to have people like you too who know how to treat women in this population, because there are definitely precautions and contraindications to exercise and how you position your body, and even some movements can make your symptoms worse. So unless you know that knowledge, it's you can make someone's pain or problem worse. Actually,
and that's why it's important to seek the advice of a physiotherapist or an osteopath or a trainer or a yoga teacher who understands pregnancy and postpartum, because you know there's a whole lot going on in the body, that is so different. You don't have the body that you normally have.
No.
And you don't, when you're postpartum, you don't have the body that you had before.
No.
You know, and one of the things that I remember about you treating my client is that she was quite a fit girl, and she was used to doing quite vigorous exercise after, you know, and her baby was about maybe 3 months old, and she was like, "Can I get back into doing my, I think it was CrossFit or something?"
Yeah, she did quite high intensity exercises.
Right, and I remember you said no,
no, not after you've had a proper assessment and ensuring
and up to 6 months, you know, high impact exercise can be damaging to the ligaments, the ligature of the pelvis. And you could be making issues a lot worse.
Yeah. So there's definitely new guidelines out now that women shouldn't be returning to running until at least 6 months after you've had a baby, whether that is a cesarean or a vaginal birth. It's a lot of your structures and your muscles and things have changed in your body, and it's not how it used to be before you had baby.
Right.
And also we can't put a blanket statement on every woman, because every woman is so different. You and I look so different, so we can't always put rigid formulas to every woman. Correct. As well.
So it makes perfect sense, doesn't it? And everybody, you know, every woman had different kinds of strengths before they got pregnant, and some recover quicker than others. But the thing is, I think the point being is that until you've had that assessment, you don't know.
No.
And I think we'll go on in a minute to talk about what that assessment involves, like what happens when you go to a pelvic physio. But I think that's really important, because you can be doing stuff and you might feel fine. But what you actually just pointed out to me, which I didn't even think of or consider, is that sometimes you're doing damage to the pelvic, organs or in parts of the body that it's not going to come out for years later.
Yeah.
When you said it might affect you in the menopause.
Yes.
I didn't know that.
No, yeah. So a lot of women don't actually, because they might feel fine now, and that's fine. But if you continue doing some of the movements now on top of, say, impairment or injury that you've had, you might actually make things worse in the long run. And when you hit menopause, or when you have another baby. Yeah, so it's good to have all this knowledge now and know what is safe and what isn't, and do the correct exercises so that you don't have long-term problems when you hit menopause, because that's when your hormones change and things tend to get a bit pear-shaped, you know. Everything deteriorates, such as like our eyes and our ears, so it's no different to any part of the other body.
The pelvic organs are affected as well. But the other thing is, though, that with the right care and attention and love, you know, that you can improve matters, obviously. It's not all downhill. Tell me it's not all downhill.
No, it's not all downhill.
That area myself, just seeing it on the horizon, you know.
But also people think that it is normal to have some of these symptoms, and they just live with it too.
Right. So when you say symptoms, do you mean things like incontinence?
Yeah, incontinence. So you'd be surprised at how many people are wearing just liners or pads because they're afraid of leaking when they exercise or when they go for a walk or just everyday activities. I've just lost my train.
They don't need. What I mean, I think what you're saying is they don't need to be putting up with those symptoms.
No, exactly.
They can be, they can be treated, but with that embarrassment, but also that general thing of thinking that they, that's just a woman's lot kind of thing.
Actually, that's what I was thinking about, is that if you're not asked these questions, then you don't tend to give that information out or think about it too. So a lot of doctors won't ask you how your problem with your bowels or your bladder, are you leaking when you cough, laugh or sneeze. They don't ask those questions.
Are you having pain during sex?
So unless you willingly share that information, they're not going to come forth and help you out. So a lot of my women who come to me for an assessment, I go through a comprehensive assessment asking loads of questions about their medical history, what their social history is like, so what they enjoy doing, sports and hobbies, talking about their bladder and their bowels. And until they've been asked those questions, they don't realise, actually, I am having issues there. And it's not how you've been saying that it's meant to be, So they don't actually know what is normal as well. They may be going to the toilet every 20 minutes. or 20 times a day, which isn't normal. So, so unless someone points it out or tells
just
them,
asks.
that,
that's
they
absolutely
won't
right.
be willing to share it because it's an embarrassing topic.
Yeah, that's brilliant. Hey, I think maybe what we're going to do now is probably end this interview now, and then what we'll do with the next one in our next version is we'll talk about actually what happens when you come to a pelvic physiotherapist and what to expect. Is that okay? Would you be cool to do that?
Yeah.
Brilliant.
Okay.
Thank you so much.
Thanks.
That's great.